That's okay. If you just have to talk, I just ask you to step out if you don't mind, because there's going to be background
All right,
noise. Yeah.
I'll step out.
I will record it for you.
Okay. What is this?
Well, this is the pre-classer for bariatric surgery. We're just waiting to start.
Computer here's not pulling up the slide, so I am sending it to myself. All right, guys, I'm going to share my screen. Thank you again for being patient. I appreciate it. Whoops, wrong one. Nope, don't share that one. Darn it. There we go. Okay, so everyone, can you hear me okay? Yes. Okay, great. Perfect. All right, so I'm going to, if you're on the phone, mute you just to prevent any background noise. I'll leave plenty of time for questions as we go. You'll get a copy of everything we go through as well, class. So if you want to go back and look at things, you'll have all of that to refer back to. My name's Chelsea. I'm the bariatric coordinator here at the hospital. I'm also a registered dietitian by training. So we're going to go through everything you need to be prepared for surgery, and that will include all of the nutrition stuff, the liquid diet and everything like that. So we're going to talk about some of the enhanced recovery protocols that we follow here at Tempe St. Luke's. We're also going to talk about what to expect during your pre-admission testing. The ladies here have already done it, so it'll be a repeat for them, but want to go through that process for the rest of you. How to get yourself ready for surgery, what to expect when you're actually here at the hospital with us, how to take care of yourself in those early days at home, and then all the pre-op liquid diet, diet advancement information as well. So, first thing I want to talk about as we get started is enhanced recovery. So enhanced recovery is a concept that's been around for quite a while when it comes to gut or belly surgeries, but it's relatively new in the world of bariatrics. It just rolled out as a national project in 2017, 2018, and we are incorporating those concepts here this year. So the goal is that we are optimizing patients' health status as much as possible before surgery. We have very structured before and during and after surgery pathways to help control your nausea and your pain, and those are working incredibly well for patients. We want to make sure that patients are really engaged in their own care as well as we get you through surgery. We want to make sure that you have a say in the care that's provided to you and that you're communicating with our staff. So all in all of that being said, our goal is faster recovery, less pain and nausea, getting home out of the hospital faster than maybe you would have otherwise, and hopefully reducing the risk of you having to come back to the emergency room or be readmitted for those things like nausea, vomiting, and pain. So for those of you who have not yet done your pre-op testing, that will occur usually about a week before surgery, maybe 2. The office sets this up for you. So if you have questions about your pre-op testing appointment, please follow up with the office. Arrive 30 minutes early if you can. You do need to be fasting. We want your stomach to be empty. Taking morning medication is perfectly fine, but other than that, no eating or drinking until they tell you you can after your testing. The testing can take a few hours, so be prepared for that. If you're on your liquid diet already, I would recommend bringing a protein shake along. That way you can start sipping on that when they let you know that you can. Tests are going to include labs, nicotine testing for anyone that may require that, EKG, chest x-ray, and the abdominal ultrasound as well. COVID testing. We are actually requiring COVID testing for our patients, although the hospital is not. Patients that have obesity are at a much higher risk when it comes to complications related to COVID, We want to make sure that we are not doing bariatric surgery while anyone may be positive for COVID-19.
3 days prior, so.
Yes, 3 days before surgery.
On the 7th, I get an appointment.
You will need to bring a list of those medications with you to the PAT appointment. Yes, it's in your chart, but if there have been any changes, if you've been to the doctor, in the last couple of weeks and then made changes to your medications, the hospital's going to need to know that. The RN will review these medications with you and explain what those changes may be. So I would recommend, especially if you have a pretty long medication list, writing out what you take, when you take it, and the doses before you come to your visit. It'll save you some time when you come to your PAT appointment. Another big thing to know about medication is you can take pills after surgery. You do not need to crush or have all of your medications turned into liquid after bariatric surgery. We do recommend you take one pill at a time over a period of time, and don't take handfuls of them if you have a pretty long med list. But you are more than welcome to continue to take your pills, and we will address it if we need to, if you do have problems, tolerating those after surgery, but that's very, very rare. There are a few medications that we would like you to stop specific to bariatric surgery. So 1 week before your surgery, we recommend that you stop taking any type of NSAID. That includes aspirin, Advil, Motrin, Aleve, ibuprofen, anything with ibuprofen in it. And then on the prescription side, more common ones are Mobic, diclofenac, meloxicam. All of those need to be stopped 1 week before surgery.
Is Cymbalta NSAID? It's diflu something.
I don't know. I'll have to look that up.
Okay.
Yeah.
Yeah, I have question about that later.
Okay, sounds good. All vitamins and minerals need to be stopped 1 week before surgery as well, whether they are prescription or over the counter. We'll want to make sure that you're stopping those too. And then if you are a patient that has diabetes or takes any type of diabetes medication that lowers your blood sugar, we ask that you cut your doses down when you start your liquid diet. So you will, when you start your liquid diet, cut those doses in half, and then just monitor your blood sugar very, very closely. We recommend you follow up with your primary care doctor or your endocrinologist, whoever manages diabetes for you, in case they have any other recommendations or if things start to get a little funky with your blood sugar. As far as new medications goes, at your final visit in the office, typically that's with Luke, the PA, he will be sending in all the prescriptions that you need for surgery. We want you to pick these prescriptions up before you have your surgery. That way you have everything you need at home. It gives us time too, if the pharmacy is out of stock in something, if we need a prior authorization for something, the office has some time to get that figured out for you. I want to go through the medications that you will be receiving, and then Luke will follow up with you about this in the office as well. But I think it's important that you hear things more than once. Sometimes it helps it sink in a little bit better.
Yes.
So one of the things you're going to get a prescription for is a scopolamine patch. This is a external sticker, like a nicotine patch almost, but it actually goes behind your ear. I know it's kind of hard to see me from there, but it's going to go behind your ear, okay? And you're going to put this on the night before your surgery.
What is that for?
We'll go through that.
Oh, okay.
Yeah. So this is to help control nausea. It's actually something that they prescribe often for motion sickness, like for people that are going on cruises and whatnot.
Is it like Dramamine or?
Nope, it's called scopolamine.
Scopolamine.
We typically prescribe these in packs of 3, so hopefully you'll have a few left over at home that you can reuse if you need to. Now, just a forewarning with these patches, sometimes insurance will not approve them or it takes an authorization. So if you have trouble getting this patch in time for surgery, it's okay. we will put one on you when you come to the hospital. We would prefer it if it's on the night before surgery because it works better. But if you're just having a heck of a time getting it, don't stress out. The hospital will put one on you when you arrive. You can also, if insurance isn't covering it or there's a hiccup there, you can also look at GoodRx to see what you can find if that's affordable. If not, again, we'll put one on you here at the hospital. You will also get a prescription for acetaminophen, Tylenol. This is our primary pain control after surgery. I know that sounds crazy, but maximum dose Tylenol, when it's taken around the clock, actually works incredibly well at controlling surgery pain. So this is our number one defense. Our standard protocol for secondary pain control for that more intense pain is oxycodone. Now, obviously, if there are allergies or if you've taken this before and it doesn't set well with you, if it makes you nauseous or makes you a crazy person, then obviously we can change this. But this is just our typical protocol. You will receive Colace or docusate sodium. This is a stool softener. We'll ask you to take this while you're taking any prescription pain medication to help prevent constipation.
Mm-hmm.
You will also get a prescription for Zofran. Zofran is also for nausea. And then finally, if and only if you have a gallbladder, you will receive a medication called Reltone. Reltone works to reduce the risk of developing gallbladder disease or gallstones when you're losing weight very quickly. It's very relatively common after bariatric surgery. You're at a higher risk for developing gallstones because you are digesting and breaking down fat so rapidly. This comes from a specialty pharmacy, so you will not actually pick up Reltone from your local pharmacy. It will be shipped to you in the mail. The specialty pharmacy will call you to verify all of your shipping information. So please pick up the phone if it looks funky. If it's a pharmacy calling that you're not familiar with, please pick up that phone call. They cannot ship it until they speak to you or make contact with you. If you have questions about it, definitely let us know.
I have a question
Sure.
about that. You mentioned only for those that have the gallbladder.
Yep, only if you have a gallbladder.
If I don't have, where do stones go? Somewhere?
If you don't have a gallbladder, then you don't get stones.
Oh, so
They just don't get created.
oh, okay.
Yep, so you're off the hook.
I'm already ahead of
You
the
are.
game.
Does anyone
As usual.
have questions about went through before we move on? I know that's a lot of new information, so I just want to make sure. Okay. All right, so like I said, Luke will run through all of this with you again when you come in to see him for that last visit before surgery. So if you think of anything medication related, he's the best one to ask. All right, this mouse is really touchy. Okay, so another layer of preparation for surgery is making sure your skin is clean. Before surgery, we're going to ask you to shower with a special type of soap called either Hibiclens or chlorhexidine. They're one and the same. We're going to ask you to shower with this the night before and the morning of your surgery. Did you ladies receive your chlorhexidine
Yes.
from Shelly? Perfect. Shelly in pre-op testing will provide the chlorhexidine to you with instructions, so you don't have to purchase this. If for some reason you would need to, you can buy it over the counter at any pharmacy. Now, after surgery, you can shower the day after surgery. We do not want you to scrub or pick at your incisions. Just leave them alone. Itching is normal, just like you have a cut or a scab, it starts to itch, very normal. Healing process. Keep your incisions clean and dry. Water and soap can run down your body, that's totally fine. And you do not have to cover these incisions with anything unless you're specifically told to do so. They can get wet, they just cannot be soaked or submerged in a pool or a bathtub or something like that for a few weeks.
How big are these incisions?
We'll talk about that in a little bit. Yep.
Okay.
Another thing for women who are still childbearing age is pregnancy prevention. If you are not currently on any type of birth control or pregnancy prevention, we highly recommend that you establish something before surgery. Pregnancy is recommended to be avoided for at least 18 months, if not longer, after surgery. So we want to do our part in preventing that. It's very, very hard for mom to get through that pregnancy easily when you are, in preset to weight loss mode, especially if you're still on a restricted diet, you haven't really normalized your eating pattern yet. I've seen it happen more than once, and we get them through, but it's very, very difficult, I will say that. So men and women both can experience increased fertility very quickly after
really?
weight loss surgery.
Why is
So
that?
even women who are on borderline to menopause may see a backslide to where they start having normal cycles again for a while because of the hormone reset and regulation. So definitely discuss with your PCP or your OBGYN, whoever you see for women's health needs, if this is something you need to discuss or if you have questions about.
Well, I've got a question.
Sure.
I had a hysterectomy and I no longer have a period.
Sure. So
So
then it doesn't affect you.
No, but yeah, it might, because you're doing something that's going to affect my hormones and my hypothalamus or my thyroid. So what's going to
Sure.
happen to a perimenopausal woman?
I mean, if you no longer have a uterus, then you are physically not capable of having cycles, so nothing will be affected there, because there's nothing to affect, because that organ is missing.
Does it affect the our estrogen or anything?
It shouldn't. Not in that way. Not in that way. No. Mm-mm.
I do have a question about
Sure.
it. On the contrary, I'm taking a medication to avoid estrogen.
Okay.
It's cancer prevention,
Gotcha.
tamoxifen.
Okay.
Do I should stop taking it before the surgery?
Not
or
unless they specifically told you to
they
today.
haven't telling me
Nope.
nothing.
Then you're fine.
Okay.
As far as packing for the hospital, make sure you bring your insurance card and photo ID with you, of course. CPAP or BiPAP machine, if you use one while you're sleeping at night, bring your own machine. Be sure you know what your settings are, because we will use your machine if needed overnight. Comfy clothes, if you want to bring your own pajamas or nightgown or bathrobe, that's totally fine. We will have you up and walking around quite a bit. So if you want to be comfy and in something other than a super glamorous hospital gown, you're welcome to bring your own clothes. Same with shoes. We will give you some very, very beautiful bright yellow socks while you're here. But if you would prefer your own slippers or a sandal that slips on and off but is secure on your foot, you're welcome to do that as well. Because like I said, we do want you up and walking as much as possible. And we'll talk more about that in a second. And then just daily personal hygiene products, your toothbrush, your face wash, deodorant, that type of thing. Most people do not shower here just because you're not here very long, which is a good thing. But
Come prepared.
if you want to and want your own soap and stuff like that, you're welcome to bring it. Please leave valuable stuff at home. You cannot wear jewelry during surgery. Maybe bring a tablet or something if you have it for entertainment purposes, but don't bring tons of cash. Don't bring expensive jewelry. Leave all of that stuff at home where it's safe and sound. So, the day of surgery, you will arrive at the main entrance of the hospital. You need to be here 2 hours before your scheduled surgery time. So if your surgery is at 8 a.m., you need to be here by 6. Once you're here, they will take you to the pre-op area. They're going to review your medical history, go through the consent forms with you, and sign all of those together with witnesses, start your IV, of course. And then several people are going to come talk to you. Dr. Schuster and his team are going to come talk to you. Your anesthesia provider is going to come talk to you. There's going to be a registered nurse there helping you get ready for surgery and start administering medication as soon as you roll in the door. Someone else from the OR may come in and say hi and verify some information with you. So it's a busy place. Once they're ready, they'll take you to the operating room, and surgery is normally about an hour to an hour and a half, just depending on the type of procedure that you're having. And I think mostly bypasses. We've got 4 bypasses and 2 sleeves. So we've got a good mix of people in the call today. So for my sleeve people, you're looking at probably just under an hour for the most part for actual surgery time. Bypasses usually a little closer to an hour. When you're done in surgery, you'll move to the recovery room, where you'll stay for at least an hour before you actually move upstairs to your hospital room. In the recovery room, they're starting your pain control, your nausea control. We're making sure that all your vital signs are stable, and everything, that you're waking up from anesthesia as expected before we send you upstairs to your hospital room. So with bariatric surgery, we do these procedures laparoscopically. So what that means is they are using several small incisions around your abdomen and really long instruments to do the job. Through those small incisions, there's no big incision going down your belly like you see in the right-hand sided picture there. Most people have about 6 incisions typically. They are about an inch long, maybe a little less, depending on where they're at. They may not be in these exact locations you see in the picture. Every person's body kind of lays differently when you get put under anesthesia, so that will depend on where they put those incisions. You will definitely have one near your belly button, and that's where the camera goes. So there's a lot of motion happening at that location. It's very normal for that incision to feel more sore and tender and maybe heal a little bit slower than the rest of them, because that camera is moving constantly while they're doing surgery. If you're having a bypass, the left-hand side tends to be a little bit more sore than the right-hand side, just because that's where more of the action is happening and taking place. So that's also very expected. For our procedures, we do not use drains. We do not use urinary catheters. We don't use stitches or staples on the outside of your body. So really the only attachment that you'll have after surgery is your IV, providing IV fluids, and that's about it. On the insides of these incisions, they will put some stitches, typically, to close those inner layers of tissue. Those stitches will dissolve over time. Those are not stitches that has to be removed by a provider later on. On the outside is just skin glue, like super glue for your skin, holding your skin, that outer layer of skin closed. So no, like I said, no stitches, no staples on the outside, no coverings of any kind unless, someone specifically tells you to. If you have one that's a little bit oozy, you can put a Band-Aid on it or something, but that's really all you have to do. Pretty easy wound care. But the nurses in the hospital will kind of review everything with you before you go home.
I was curious, maybe a few years ago, wasn't it a lot bigger of a deal to the wound care and everything? I had just heard from another friend.
It depends on how the surgery is performed and, how they choose to close those incisions. Every surgeon's a little bit different, so.
I've just heard it's gotten so much better.
Things are always advancing in healthcare.
Yeah.
Things are constantly changing and improving, so that's a good thing for the patient for sure.
Yeah.
Once you get up to your hospital room, or on the floor as we call it, typically you're just there one night. So let's say you're having surgery on Monday. Most of the time, Dr. Schuster's patients are out of here by Tuesday at lunchtime, or sometimes even earlier than that if you're doing well. What we really look for before we send you home is that your pain is controlled with medication and doses you can take yourself at home. We want to make sure that you are not too nauseous or having any vomiting, and we want to make sure that you're drinking enough fluid to keep yourself hydrated when you leave. So that's really all we look for before we send you home. Everything else, will come with time as you get home from the hospital and continue to recover. During and after your surgery, you can have visitors. If someone wants to wait here in the hospital, they're welcome to hang out in the waiting room. Just, let them know it is going to be a several hour process from the time you get here to the time you are actually hitting your hospital room. So if they want to go mill around town, if they want to go home and come back, whatever, they're welcome to do that. There's always a staff member in the waiting room who can provide updates about your status if they need to. As of right now, visiting restrictions for the hospital are 2 per patient, no one under the age of 12. They are allowing 1 overnight visitor to serve as the patient advocate, if you will, if needed. I will say our rooms are not huge, so unless they just absolutely want to, or you absolutely want someone with you, they're probably going to be more comfortable in their own bed. Our cafeteria is changing management, so right now they only accept cash. So just be sure if you are going to have a visitor and they're going to want to eat a meal here that they've got some cash available. There is an ATM here in the hospital as well if needed. So right after your surgery, you will start stage 1 of your diet, and that includes ice chips and clear liquids. I know it's really gourmet stuff, but you will continue that through the whole first day of surgery, and you will start receiving this as soon as you're awake after anesthesia. There's no delay in your oral intake. For pain control, that day of surgery, you will be receiving Tylenol around the clock. You will be receiving oxycodone, and then the strongest medication that we typically order is Dilaudid. Now again, if there are aversions, if there are allergies, this process is changed, but this is what the vast majority of our patients receive. For nausea control, you will have Zofran, which is the same medication you'll have at home, and then you have the patch behind your ear. We are also very proactive about blood clot prevention with our bariatric surgery patients because you are at higher risk. Everyone going under general anesthesia is at risk for blood clots, no matter who you are, no matter how healthy you are, no matter if you're 20 or 75. But having obesity does increase that risk. So you will actually receive 2 medications, like just during and right after surgery, to help keep your blood thin for a short period of time. Thinner, I should say. We will also put some compression devices around your calves. It's basically like a blood pressure cuff, but more comfortable. And that hooks up to a little air pump, and it's just going to kind of massage your leg. It kind of tenses and relaxes gently to help increase your circulation. And then we want you up and out of bed and walking as much as you possibly can. That activity starts usually just a couple of hours after surgery. Our hope is that when you have to go to the bathroom for the first time after surgery, you are walking yourself to the restroom. Obviously, if assistance is needed, they will help you. We don't want you falling down. You may be a little wobbly on your feet after anesthesia. They're obviously going to assist you when needed. But we want you to become independent in your movement as fast as possible. We have a water station. We want you to get up and refill your own water if you run out. There's no reason why you can't do those things for yourself, because you have to do those things for yourself when you go home. And then we want you up and walking as much as possible. Our goal for you is 20 laps around the unit before you leave. That's about 1 mile. So between the day of surgery and the morning after, when you go home, hopefully you've walked about 20 times.
So question.
Sure.
So, for example, can I do like a light treadmill when I get home?
We'll talk about activity when you get home in just a
Okay.
second, yeah. So the morning after your surgery, you will move up to stage 2 of your diet. Stage 2 is full liquids and protein shakes. I will come by and see you all in the morning after surgery to review stage 2 with you to make sure you know what you're doing when you leave the hospital. But you will quickly advance to that next stage just the morning after surgery. Pain management stays the same. Nausea management stays the same. Blood clot prevention, you still have those compression devices, and we want you out of bed and walking as much as possible, but you won't receive any medication. And then as far as activity, again, we want you moving as much as you can, refilling your water, going to the bathroom, getting up and walking around as often as possible in the hospital and when you go home. So that being said, when you do get home from the hospital, it is important that you stay on top of your pain management. As much as no one wants to take more prescription medication than they have to, it is important that you keep that pain under control, because if it gets out of control, it's a lot harder to wrangle back in. So we want it to stay in a managed state at all time. That being said, surgery is not completely painless, okay? Our goal is not to have you flying in the clouds after surgery. Our goal is to make sure that you can do what you need to do comfortably.
Oh, you have to go outside.
That's okay, take your time. Keep that pain under control. If you are having trouble with pain management, please call and let us know. If you have any issues getting your pain prescriptions filled, call and let us know as soon as possible. Patients are notorious for calling us at like 4 p.m. on Friday with prescription problems, and it's really hard for us to get stuff done at that point in time. So please call as soon as possible. That's why we really want you to try to fill all those prescriptions before you ever have surgery. Remember to take control of that nausea. Use those medications. If you were able to get multiple patches, replace it if you need to. One patch lasts for 3 days, so after 72 hours you can peel it off and put on a new one if you need to. It's important to stay up and walking. Just like you were walking periodically in the hospital, we want you to continue to do that at home. It's hot outside, so like you were asking, if you do have a treadmill at home or you have a gym membership and you want to go walk very slowly, you're welcome to do that. Just keep in mind that you are going to tire out faster. You're going to get winded faster for a couple of weeks after surgery. That's really, really normal. So if you go 2 miles now, start with half a mile after surgery and expect to maybe need some breaks, or for even that to feel a little bit difficult at first. Make sure you're drinking. We're going to talk more about hydration in the nutrition section here in a second, but it is important that you are staying on top of that fluid intake and not allowing yourself to get dehydrated. You will stay on the stage 2 diet for the first 2 weeks after surgery. Again, we'll go through that together here in a minute. You will have some lifting restrictions, no more than 15 pounds for the first couple of weeks, and then kind of as tolerated from there. If you do have an emergency medical issue, I'd much rather you come back here to Tempe St. Luke's if you can. We are a nationally accredited bariatric hospital. We have to uphold a lot of very, very careful care standards. So we want to make sure that you're getting the best care possible, that Dr. Schuster is available to help you if anything does come up. And all of our staff receive, specialized training in taking care of you all as well. And then as far as going back to work, going back to normal life after surgery, we always say at least 2 weeks to start. That's our recommendation, and then play it by ear from there. If you have a very active job, if you're lifting a lot, pulling and tugging on things, then you may need more time. But usually about 2 weeks, people are still feeling kind of down and tired and trying to find their new routine. So we recommend at least 2 weeks off, or 2 weeks of taking it easy before you jump back into things. Just a reminder about things to avoid after surgery. NSAIDs, okay, even after surgery, NSAIDs are not okay. They need very, very special permission from someone that works in bariatric surgery to be taken, and you need very close monitoring after that.
Question, what is NSAID?
NSAIDs is like ibuprofen, like those medications we talked about
we cannot?
earlier.
Okay.
Yeah, ibuprofen is off the table after bariatric surgery.
Forever?
Forever. Yep. Oral steroids should also be avoided as much as possible, but especially within the first 6 to 8 weeks after surgery. If they're needed after that, it can be used very sparingly, but needs to be very cautiously done. Smoking anything of any kind, nicotine of any kind, smoked, vaped, chewed, patches, gum, nothing is okay after bariatric surgery. And then carbonated beverages. When it comes to nutrition, carbonated beverages is really the only thing we tell you absolutely not to. And that's because those bubbles cause a lot of indigestion. They do take up a lot of space. And people tend to feel pretty bloated and uncomfortable when they're drinking them. So, again, carbonation is really the only thing that we say no to forever when it comes to nutrition.
Oh, I missed a very important point. That is
we can cover it afterwards. We'll get you caught up.
I'm recording, so I can pass it on to you.
Perfect. Okay, any questions about what we've talked about so far before we talk about risks of surgery? Patricia, go ahead.
Yeah, I've got a question on the, and it's back closer to the beginning. We're talking about the COVID test.
Okay.
Surgery is going to be on Monday. And can I use the home test or do I have to go into my PCP?
We do not recommend home tests because they're less accurate. So it'd be best if you actually they're less sensitive, I should say. So it'd be best if you had an actual PCR test is what's needed. And if you live nearby, like they can do that for you here at the hospital, but if you're a distance away and it's easier for you to go to your PCP or somewhere else, that's okay. We just have to have those results, at least by the morning of surgery.
Okay.
Yeah, but all of our they send an order to the hospital for everyone, whether you're going to come here or not, just so we can say, oh yeah, you have an order, come on over. But yeah, if it's closer for you to go somewhere else, that's totally okay. Just make sure we get those results in time.
Okay, and then I've got one other question.
Sure.
And this is kind of a weird question.
That's okay.
With the stomach that is, it's being made smaller, I'm having the bypass. The other part of the stomach, is that removed or left in there?
So for you with the bypass, nothing is actually getting removed. Things are just going to be like hooked up differently. So remind me at the end, I can show the pictures of each surgery, just as kind of a refresher for everybody.
Yeah, that'll be good.
Okay,
Yeah.
thank you.
Yeah, you're welcome. All right, Jamie.
Hello.
Hi there.
I just have a question in regards to all of the steroids and the NSAIDs. So I have chronic migraines and I have also a tumor.
Okay.
So those are very, I need those. You know what I mean? And it's the same thing with the caffeine. So I'm actually really starting to get nervous and worried about the surgery, and I just kind of want some more information of what to look out for. I know that you said that moving forward, like with aspirins, you would need a bariatric specialist to kind of talk you through it and be able to give those to you.
Yeah.
What about my neurologist? Like, they've always pushed for weight loss and they've always discussed the surgeries and stuff. So now I'm kind of wondering why they would do that when it's basically taking away all my medications. Like, I use the steroids to treat my tumor and to help relieve pressure, and I use aspirins, that are in Urset and Excedrin migraines to take away the headaches.
Sure. I would recommend, Jamie, and I'll give Luke and Dr. Schuster a heads up too, to be sure to thoroughly discuss that with you, or maybe even give you a call tomorrow when they're in the office. To kind of look at your medication list more specifically, talk about options that are out there. But especially with bypass, they're never going to tell you that taking NSAIDs is okay. So that's something you'll definitely want to talk to them about. So okay. I'll have them give you a call.
It's the same thing with caffeine, and since I was 5 years old and had migraines, and especially with the one of my conditions that I have that gives me headaches, I have intracranial hypertension. So I get lumbar punctures all the time. You have to have caffeine for that.
Right.
Like, I have literally caffeine and I'm like,
Other questions before we move on?
I do have questions.
Sure.
It is related what she say, because Excedrin is the only thing that take the headache away.
Mm-hmm.
Even the one the neurologist recommend, it give me side effect horrible, like
Sure,
like
some of the prescription
exactly
ones.
so.
Mm-hmm.
And when you say caffeine like a drinking coffee is not allowed.
No, there's nothing saying, and we'll talk about this in the nutrition section. We're not saying you cannot have caffeine, but it shouldn't be excessive.
Because I'm not a coffee drinker, but when I take Excedrin for headache, one of the things that help because I have the aspirin and the caffeine, and they take the away immediately. I understand that ibuprofen is out of the game completely.
Yeah. Aspirin is an NSAID too.
Yeah.
So again, that's something I'll let them know about. I can't give you that blessing because
Absolutely.
I'm not a doctor, but what I can tell you is that especially with bypass, NSAIDs are a big no-no because there's some pretty significant complications that can come up from that.
Okay. Also, I do juicing and vegetable juicing, and I definitely would like to know if I can do like the squeeze juicing, put in my preservative container to keep drinking after the surgery.
We'll talk
Or
about the
there's something-
diet after
okay.
here in just a little
Okay,
bit.
perfect, good.
Yep. All right. 2:45. I want to keep moving so we get through everything, and then if there are questions that we don't get to, you all will have my contact info, and I'm happy to touch base with you one-on-one for like more specific things. All right. So risks of surgery. Scare anybody by any means, but to make sure you all are informed and understand, and can really help us in caring for you when you leave the hospital. So, anytime you're going under anesthesia, anytime you're having a procedure, there's risks, right? The good news is that with bariatric surgery, it's such a pre-planned process. I know all of you have been going through this for months. It seems like a very long road, but we are helping in, evaluating your overall health to control for some of these standard surgical risks that are always on the table. We want to make sure that we're optimizing your health and factors to make sure that you are safe enough to undergo a surgical procedure. Now, with bariatric surgery, there are a few additional complications that are important to be aware of. For you all as the patient, it's important that you're making us aware of how you're feeling so we can help, identify any of these that may potentially crop up. A leak is something that's possible after any type of bariatric surgery, whether it's in the pouch of the bypass or the pouch of the sleeve, or the intestinal connection of a bypass surgery. Now, leaks are incredibly rare. There are less than 1% of these across the nation that occur every year, okay, out of the hundreds of thousands of bariatric surgeries that are performed. But there are a lot of patient-related factors. The reason we put you on a modified texture diet after surgery is to allow for healing and prevent a leak. The reason we don't want you taking steroids after surgery is to maximize your healing potential and avoid a leak. The reason we tell you not to smoke or use nicotine is because it affects your circulation, which affects your healing, which could cause a leak. So if you are following the guidelines that we give you, asking questions before making decisions if you're not sure, we can avoid this leak from occurring. Now, within your surgery itself, Dr. Schuster will perform a leak test to make sure that there in the moment everything is closed and patent and not leaking. In my time working with him for 2.5 years, there's never been a leak for someone within surgery, so it's not really something that we check for always, to be sure. Only in an emergent situation would a bariatric surgery have to be converted to an open. I've been working with bariatric patients for 7 years now, and I've seen this happen one time, and it was in a patient that we thought it may need to happen in any way, and they wanted to proceed regardless. So again, not something I'd be worried about. It's always a risk, again, with laparoscopic surgery, but never something that we ever anticipate. And then for gastric bypass patients, there are a couple of other complications that are more particular to this type of procedure. One of those is an internal hernia. So kind of backstory, a hernia is essentially a hole somewhere inside your body where it's not supposed to be. Whether it's in your abdominal wall, like a lot of men get down in their groin area where intestines are poking out of it, whether it's in umbilical hernia, like a lot of women after pregnancy get, again, intestines poking through the abdominal wall. This is inside your body. So to do the bypass, we have to pass through connective tissue. And that creates weak spots in that connective tissue that kind of holds everything where it's supposed to be. Our organs are not just floating around in an ocean in there, okay? Like I think a lot of us think. They're connected. They're staying still for the most part. So Dr. Schuster does actually reinforce these weakened areas to prevent hernias. Hernias are incredibly rare. Again, in my time in bariatrics, I've seen it happen one time in a bypass patient. And this risk does go away over time. Once you get through that very rapid weight loss stage, 6 months to a year after surgery, that risk of hernia really kind of goes away. Sorry guys, I'm just gonna close this. All right, and then a stricture is basically when the intestinal connection of a bypass becomes too tight during the healing process. So think about anytime you get a cut or a scrape, right, and you get a scab, that scab becomes tight, right? It's hard to bend it. So you get a cut on your knuckle, it's hard to bend your knuckle once it scabs over. Kind of a similar process here. So that stricture is formed in that intestinal connection. Sorry guys, it's hard to see up there, I'm sorry. It gets too tight, okay? So food and liquids is difficult to pass through that area.
That's how you know you got something like that.
Yeah, so if you're, taking the tiniest bite, the tiniest sip, and it's always incredibly painful, or you're regurgitating it, that's something we definitely want to know about, because it could potentially be a stricture. Again, strictures are rare as well, but they are slightly more common than some other things. So basically, if you're having any
Are they
problems,
fixable?
any concerns, to let us know. Yeah, if you develop a stricture, what they would do is go in with an EGD like you all had before your surgery, find that area that's too small and dilate it or stretch it back out to be normal size. So it's a pretty easy fix, if you will, but definitely not something anyone wants to experience. And then finally, the risk of death in bariatric surgery is about 1 in 1,000. This is the same rate as those undergoing a gallbladder surgery. So this is not astronomical by any means. The primary cause of death in bariatric surgery patients across the nation is pulmonary embolism. A pulmonary embolism is a blood clot that broke free from a leg or an arm and ended up in the lung, which causes a blockage of oxygen. And it could potentially be fatal. So to prevent that from happening, we have to prevent blood clots in the first place, which is why we are so proactive about our blood clot prevention around here for our patients. I myself have looked at every single surgery that's occurred here, going all the way back to the beginning of 2019, and there have been 0 bariatric surgery-related blood clots. So what we're doing is working very, very well. The second cause of death in bariatric surgery patients is cardiac-related issues, which is why we are so incredibly thorough with cardiac workups for most patients before surgery. You're getting EKGs and chest x-rays. Most patients are doing cardiac clearances with a cardiologist with testing to make sure we are, ruling out any risk factors or tuning up anything that needs to be tuned up before surgery. And then a leak, like we already talked about, can be fatal if it does occur and it's not caught early. Leaks are sometimes hard to catch because sometimes they just feel like back pain or just generally like feeling ugh and icky. Maybe you're kind of running a low-grade fever and you're not sure why. So if anything just seems off or funky after surgery, please let us know. We would rather be safe than sorry and look into any kind of odd symptoms rather than something get too far out of hand. And then other things to keep in mind, if anything changes with your health between now and the day of your surgery, especially if you've been prescribed any new medication, we want to know about that. And then if anything changes, you know, with your ability to recover or your support system, or you know, an unexpected financial something occurs and you're like, oh my gosh, I can't afford protein shakes, I can't afford vitamins, I don't know, you know, we want to make sure you're set up to succeed after surgery. So if we can help, we will. If it's a bad time and, you know, something unexpected occurs and we need to delay it, let us know. I know none of you want to do that because you're here, you're ready, you're scheduled, you've been waiting for this for a long time, but we also want to make sure it's done right when it happens. So if you need anything from us, if we can help, please let us know. And then I want all of you to write this number down or put it in your phone right now. This is the after hours phone number, 602-507-4458. This is the number you will call overnight or on the weekend if anything more urgent medical comes up. You'll all be getting this in an email as well. It's actually just the number for the office, but it rolls to the answering service overnight. Please do not call this number if you are like wondering if you can eat sugar-free pudding at midnight. Okay, the residents, I assure you, will not appreciate that phone call. But if you're like needing pain medication or you're not sure if you need to go to the ER or not, that's when you call them. Okay? I know that sounds silly, but believe it or not, those phone calls have happened. So I always preface that. Urgent medical things only, please. If it can wait till Monday, if you can survive without sugar-free pudding till Monday, please just wait till Monday. All right. Okay, so we're going to move on to talk about nutrition. So I want to start with the liquid diet. The pre-op liquid diet is an essential step in getting ready for surgery. It's 1 week or 2 weeks long based on your BMI. If your BMI, or most recent documented BMI rather, is 50 or above, you will do a 2-week liquid diet. If you are at 49 or below, you will do a 1-week liquid diet. And the reason for this is because the liquid diet actually works to shrink your liver. It reduces the amount of visceral or internal fat that's surrounding your organs inside. So all in all, it's making surgery easier to do, and that's reducing your risk of complication. You know, the easier it is for them to see and move around in there, the easier and smoother sailing the surgery is going to go. So for those that do have higher BMIs, they tend to have larger livers and more internal fat than those with the lower classification of BMI. So in this liquid diet, it's clear and full liquids, very low calorie and very low carbohydrate. It's not just the liquid part that's important, but it's the nutritional value of those liquids. Adequate protein is essential. Hopefully you're getting 80 plus grams of protein a day, but with the amount of protein shakes you're going to be drinking, that should not be a problem. Your main source of nutrition is going to be those protein shakes. You're probably going to be drinking at least 3, if not 4 shakes a day to stay feeling full and satisfied. I recommend 1 shake per meal. It's like breakfast, lunch, and dinner is now a protein shake, and you fill in with the other stuff that's on the list, which we will go through right now. So again, up until the day before your surgery, you can do clear and full liquids. So protein water is a great option. Water, of course. Sugar-free Jell-O. Sugar-free popsicles, if you can find them. Sugar-free popsicles are getting really hard to find. So if you figure out where you can buy them, let me know. So if you can't find sugar-free, anything that has 5 grams of sugar or less is okay by me.
Can I prepare my own with the juicing?
Yeah.
So juicing wouldn't be sugar-free. That's still going to contain the nutrients from the foods. But you could freeze like Crystal Light or something like that to make your own. Low sodium broth or bouillon. I do recommend low sodium, especially if you're drinking more than about 8 ounces of broth a day, because that high salt content can cause fluid retention. It could potentially affect your blood pressure, and we don't want any issues with surgery. So I don't care where the broth comes from necessarily, but I do recommend low sodium if you can find it. Caffeine-free herbal tea or decaf tea and coffee is all fine. Please do not use flavored creamers, even if they are sugar-free. Some milk, a sweetener packet, that's fine.
Coconut milk is okay?
As long as it's unsweetened.
Yeah.
But no flavored creamers on the liquid diet. Gatorade Zero, Powerade Zero, Propel water, those types of sugar-free kind of electrolyte beverages are fine. Crystal Light or any type of sugar-free drink mix is okay too.
Mm-hmm.
And then on the full liquid side, you can do protein shakes, of course. Cream of chicken, cream of mushroom, or cream of celery soup. Those are your only 3 soup options. I get so many emails and questions. What about tomato? What about potato? What about butternut squash? Chicken, mushroom, or celery only. All of the other ones are too high in carbohydrate for the pre-op liquid diet.
Can I make my own creamy, my own chicken?
Probably not, because depending on how you're making it, it's probably going to be pretty high in fat and calories. So it just depends on how you're making it. If you want to send me the recipe so I can look it over, that's fine.
That's not recipe, it's just a Latino thing with the breast and celery, let it boil, and you eat that thing.
Oh, just the broth?
Yeah, like a broth.
That's fine.
And sometimes you blend the whole thing.
Oh, you couldn't do that, but you could do the broth.
Yeah, broth, okay.
Yep. Low sugar yogurt, anything less than 10 grams is 10 grams of sugar is fine. Oikos 000, Dannon Light and Fit, Chobani Zero Sugar. Those are a few brands out there that are good. Low carbohydrate milk or skim milk is fine. Fairlife is a low carb milk brand that's out there. It's a little bit more expensive, but it's an amazing product for bariatric surgery patients. It is. It's really tasty.
What is the name again?
Fairlife.
Fairlife. It's like a milk,
It's milk.
cow milk.
Yeah.
It's dairy milk, but it's lactose free. It's lower sugar and it's higher protein.
What about
Really
coconut
great
milk?
option. Like I said, coconut milk is fine as long as it's unsweetened.
Soy
Soy milk, almond milk, oat milk, any of those other things are fine. They just need to be unsweetened.
So no sugar at all.
As
No
low
sugar
as
at all.
possible.
What about stevia?
That's fine.
So I
No
can
calorie sweeteners are fine.
stevia. Okay, yeah.
Yep. So then the day before your surgery is clear liquids only. Protein water, your Jell-O and popsicles, your broth, coffee and tea, decaf, your sugar-free sports drinks, and your sugar-free drink mixes. So none of the thicker stuff. This is just the day before surgery, okay? Now, the night before surgery, we want you to do some carb loading. So around dinner time, after dinner time, wherever you want to start, up until the time you go to bed, we want you to finish 32 ounces of regular Gatorade or Powerade, the stuff that does contain sugar, just the night before surgery, okay? We want you to drink all 32 ounces before you go to bed, and then you can actually keep sipping those other sugar-free clear liquids all night long. If you wake up at 2 a.m. and you're thirsty, go grab a drink of water, go grab some broth. That's totally fine to do. You can drink up until 4 hours before your surgery.
Can I do juicing that day?
No.
Not at all.
Gatorade or Powerade Zero
Because
only. Or Gatorade or Powerade only.
Powerade, okay.
The morning of your surgery, we want you to carb load a little bit more. So we want you to do an additional 12 ounces of regular Gatorade or Powerade 4 hours before your surgery. So I apologize if you're like the 7 a.m. person. I know that's really early for you. So I recommend maybe putting it by your bed waking up,
You see,
drinking it, and then just going back to sleep for another couple of hours if you can. The reason we do this carb loading is it helps stabilize your blood sugar throughout the time of fasting, during and after surgery, and it's also going to help prevent nausea as well, or help control nausea in a better way. Since our patients have started carb loading, we are seeing a huge decrease in actually the use of our nausea medicine in the hospital. So it is working very well. Yeah. So that 4 hours before surgery is your cutoff. Okay, if you are doing broth or water or whatever else throughout the night, that's fine. But once you do that final carb loading 4 hours before, it's absolutely nothing else to eat or drink until after surgery is over. Okay? Any questions about the liquid diet or the carb loading? Okay. This will all be spelled out for you in the liquid diet sheet I send as well. So if you do have questions about it, let me know once you review everything. So just as a reminder, in the hospital, you will start stage 1 or those clear liquids immediately after surgery. And then stage 2 will begin the morning after. And that's when you move up to those thicker liquids again. Stage 2 will last for 2 weeks, up until your first appointment in the office. Basic guidelines for that are nothing you eat should require any type of chewing. Smooth
For
soups.
2 weeks.
Yep. Smooth soups and yogurts only, no pieces or chunks. And then, of course, you're welcome to thin or dilute out things if you need to, to make them more tolerable. That's totally
Like
fine.
blend it up, everything.
Yeah, everything needs to be blended or strained.
Kind of put the vegetables there and the chicken and blend
So we
it up.
won't recommend that. We can
No,
talk about
okay.
that afterwards. Yeah.
There we go with the vegetable.
You're trying really hard to get me to say yes to this, and I just can't. So the stage, or kind of the goals for stage 2 are fluid intake number 1. We want you getting fluids first. So we want to see that you're drinking 64 ounces of fluid by day 3 after surgery. Your second goal is getting enough protein. We want to see that you're meeting your protein goal of at least 60 grams per day by day 5 after surgery. And then finally, bites and bits of food by day 7. And we want you to kind of keep this priority list in mind. Some tips and tricks for you. Drinking a couple of ounces throughout a 15-minute time period, just on repeat all day long. You will gradually be able to tolerate more at one time, but right after surgery, it's going to be small sips, just constantly through the day. No carbonation, avoid beverages or liquids that have added sugar to them, and then try different temperatures, try different textures. If you tried really hot broth and that didn't go so well, try to cool it down a little bit. Do room temperature broth or lukewarm broth, or maybe something super, super ice cold is better for you than warm stuff. Everyone's different. So feel free to play around with those temperatures. And then finally, go slow. I guarantee you that whatever you're thinking in your head right now for sipping is still too much. So you want to make sure that you are sipping as slow and steady as you can. Hi there, Terrence. Do you have a question?
I do. Regarding protein shakes.
Sure.
Can we use powdered protein mixes?
Absolutely.
Does that have to be like, okay.
Yep, absolutely. I would just make sure that there's less than 5 grams of sugar and 5 grams of fat in whatever you have.
Okay.
And then blend it with water or whatever your milk of choice is, or even half and half, to get the texture that you want. But you cannot blend stuff into it. Like adding fruit and stuff like that, you cannot do when you're on this liquid diet before surgery.
Just the milk or the water.
Just the liquid.
What about after surgery? Are you able to blend like fruit and things like that?
You can, but not until 2 weeks after surgery. So
Liquid.
it's hard because even blended, you're getting all that fiber, you're potentially getting seeds and fibrous pieces, and we just want it to be smooth and simple those first couple of weeks, and then we can get a little more creative.
What about the sodium content of the protein?
That's okay. Not super concerned about that, as long as you're not getting, tons and tons and tons and tons of sodium every day. Really, it's not something that we get too concerned about. Most of us Americans are getting too much sodium on a daily basis as it is. But, as long as you're choosing low sodium broth, I'm not too worried about it.
Okay.
Yeah. Good questions. All right, anything else?
Not for me.
Okay, very good. We will keep on moving then. I'm going to lower your hand. Oh,
And the broth has to be chicken broth.
it doesn't have to be chicken. It can be any
Kind of bone,
type.
like cow bone thing.
Yep, that's fine.
Chicken feet broth.
That's fine. Yeah,
Oh,
any
that's
type
what it
of broth, as long as it's just the broth.
The broth.
Yeah. So for vitamins, we don't want you to worry about for the first couple of weeks. You'll start vitamins 2 weeks after surgery. And what you need varies a little bit based on the type of surgery that you're having. So for everyone, you need a bariatric multivitamin. I do not recommend over-the-counter vitamins for anyone after bariatric surgery. I've been working with patients long enough to know that eventually deficiencies always crop up for those that are taking over-the-counter multivitamins. Once you get a deficiency, it's much harder to correct it. So bariatric multivitamins, in the content that I email you all, there will be some links, some options, but please, please, please ask questions before you order anything if you have questions. It's easier to talk to each one of you individually than it is to try to talk as a group, because you all are having different surgeries and your labs all look very different. But in general, bariatric multivitamin is a must. If you're having a gastric bypass, I highly recommend you choose a bariatric multi that already has iron mixed into it. You will be more likely to get iron deficiency after bypass, so you really need that iron in that multivitamin. In addition to the multivitamin, everyone needs 1,000 milligrams of calcium citrate every day. So you're looking at like 3 supplements total. 1 bariatric multivitamin and then 2 500 milligram calciums, because we have to take that in separate doses. Everything else is just as needed. Most people do have at least a mild vitamin D deficiency, but you are getting quite a bit of vitamin D from those bariatric multis and the calcium. So really, we just prescribe extra if you need it. Iron is the same for sleeve patients. You don't necessarily need that iron unless you're prone to deficiency. B12, you're getting plenty in your multivitamin as it is, so we just add more if someone's deficient.
Will you recommend any brand or?
Those are listed in the email that I'll send you. Actually, I should have printed that out for you guys. I can print what I would normally email out to you. Yeah. Another important thing is to keep it simple. You do not need all of these fancy marketing scheme vitamins that are out there, okay? You don't need hair, skin, and nails. You don't need collagen. You don't need biotin. You don't need tons of individual vitamins. Bariatric vitamins are incredibly comprehensive. I want you to keep it simple, because if you're taking super complex vitamin handfuls every day, you're not going to stick with that. You're not going to be compliant, and it's really expensive. And unless you have a deficiency, your body is just peeing out all of that vitamin stuff that you're taking. So it's really just not necessary. Like I said, you'll get some options from me, but if you have questions, you're not even sure where to start, please, please, please let me know. I'll see you all in the hospital right after surgery, so I'm happy to chat with you about it at that point as well, to make sure we get the right thing for you. Just a couple more things. We're almost done. For dehydration, it is our #1 concern for you when you leave the hospital. It's the #1 reason people come back to see us in the ER. So please, please, please stay hydrated. If you go more than a day without making progress on your fluid intake, or if you start having nausea and you're not able to drink, or any more than 1 episode of vomiting, we want you to call us and tell us immediately. you will not be able to just guzzle and chug liquid to get caught up after
With the
surgery.
IV.
You don't have space for that. So yes, if you do start, you kind of tip the pendulum towards dehydration, chances are you're going to need some IV fluids or a little bit of help getting caught back up. So we want to catch that as soon as we can. More significant dehydration can actually lead to some short-term abnormalities in your kidney function and things like that until we get you rehydrated. So we want to make sure we're very proactive about that. And this is a big one too. Your bowel habits will change after surgery. You are about to significantly decrease how much you're eating. You will probably go to the bathroom much less often than you do now. You will probably have smaller bowel movements. That's normal. You're eating a lot less food after surgery, so that should be expected. Some darker colored stools or some liquid stools the first time or two, or even small amounts of blood in your stool the first couple of times after surgery is also very normal. But if you're concerned, obviously let us know. Constipation can develop. It's honestly not super common. More than anything, it's just a delay in the restart of your bowel movements because you are going under anesthesia and you are going on a liquid diet, so we're really kind of slowing things down. Unless you are uncomfortable, if you're having symptoms of feeling like you're starting to get constipated, then yeah, absolutely, we want to take action to prevent it from getting worse. But if you just haven't gone and it's been 5 or 6 days after surgery, that's really normal.
I have a question about that.
Yeah.
I usually take psyllium husk, the fiber.
Mm-hmm.
I will be able to take this
if you're
after?
already used to it, you can keep taking it. That's fine.
even during my fasting.
Mm-hmm. Yeah,
Oh,
that's fine.
okay.
Yep.
Well,
If you're
that's a good
already
question.
if you're already used to taking that higher
Oh, yeah,
amount of
that's
fiber,
right.
then that's fine. But we don't want people to start it if
Mhm.
they're not used to
Because
it.
also there's a clear one that I saw on TV. Can I take that one too? Because the fiber one,
Mm-hmm.
the little things,
Mhm.
I
Yeah,
take that
that's
a
fine.
lot.
That's fine. Yep. And then finally, it is really important that you all follow up with us. You're going to see us 6+ times in this first year after surgery. And we can't help you if you don't tell us what's going on. As much as I wish I could just call up every patient every week and check on them, it's not possible. Dr. Schuster's busy. He does almost 300 surgeries a year. So if you do have questions, if you are struggling with something, please reach out. Please call me, call the office. We're here to help, even if we may not be able to initiate that reach out as often as we would like to. Make sure you're coming to those follow-up appointments. Like I said, you'll see us 6+ times within this first year after surgery, and more than that if you need us. You're our patient forever. And we really truly mean that. We want to see you through it all. And then just a reminder, our support groups, for whatever reason, are not very well attended, but they're so helpful. I highly encourage you to come to a support group virtually. We're doing them virtually. You never have to leave your house. There's no excuse. We do them every month. We actually have one this week. Dr. Carol McLean, who's a psychologist, is going to be our guest speaker. She does some of our bariatric surgery clearances. Some of you may have had a visit with her. She's fantastic. But you'll get the information about support groups from me in the follow-up email from class. I really encourage you to check that out and attend.
When is the one this week?
It's on Thursday at 4 o'clock.
I would like to go here.
So we do it virtually.
Oh,
So
okay.
you can join through Teams,
Oh,
just like this.
I would like to.
So you
do
don't
so.
even have to drive anywhere. Yeah. And then in addition to that, we have a Facebook group as well. So if you're on Facebook and want to join the support group there, my cursor's in the way, you can search for Bridges Center Support Group. It will ask you for an access code. That's just our way of keeping only our patients coming through that group. If you do everything it asks, it'll automatically put you in. If you miss something, it'll just make me approve you, but that's kind of what the page looks like. So when possible, we will stream the support groups through Facebook Live when we have guest speakers. That's just hard to do. but there's previous Facebook Lives on there. Patients post questions. We try to post recipes and things like that. So it's a good place to stay connected in between visits as needed. And that's about it, guys. So I want to ask first, because I know we're a little over time, anyone on the call, do you have other questions that have not been answered so far that I can address before we wrap it up?
I do have one other question.
Absolutely, go ahead.
How soon after surgery should I expect to be able to lift weights at the gym, things like that?
Good question. I would say at least 2 weeks, maybe a little longer. Normally they're lifting those weight restrictions at 2 weeks after surgery, but it kind of just depends on how you're feeling and how you're healing. But absolutely, walking, mobility in those 2 weeks, the more you can handle, the more the better, but do as much as you can handle. Don't go crazy and wear yourself out even more. But we want you to stay moving. We want you to stay active. Like I said before, just remember, it's going to be a little bit of a reset. I mean, you'll rebound quickly once you restart, but you may feel like you're getting tired faster or short of breath faster. Or when you do go back to lifting, you may need to decrease your weight and then, progress again just to make sure, because surgery wipes you out, even if it is something that you want to happen. So just keep that in mind. Any other questions? All right, everybody. Well, thank you so much. I will be sending emails to all of you that are on the phone with all of this information we went through today, the liquid diet paper. I highly recommend you print everything. If you don't have a way to print, just shoot me an email once you get it. Let me know. I'm happy to print it and leave it for you either in pre-op testing or in the office at your final visit if you want hard copies. I like to have physical paper and keep notes. I'm old school like that. Mm-hmm. But just let me know once I send everything out if you want the papers. Happy to print that for you. All right.
Okay, thank you.
Okay, thanks everybody. We'll talk to you later. Good luck with surgery if I don't see you beforehand. Okay, bye.